Yeah, I can say 97% I got back to the old stage. I fly back to Switzerland. I will have a very nice mountain vacation there. In other words, I hike, I climb. I can do it. There is no pain. All of a sudden, I had a pain attack in my right knee. This happened last December. And this pain lasted 2 months until I came to this hospital. But I live in Pattaya, and there I went to see a doctor. And the doctor prescribed me painkillers and conservative therapy. But it didn't help at all, you know. And the worst thing was I couldn't sleep at night. There was a constant pain in my knee. So I decided to do something, you know, but I never thought that once I will have a new knee or new knee joint. I never thought. I was scared too, but now I'm sitting here and I'm completely recovered. This hospital. Yeah, that's funny. Once I had to pick up a friend at Suvarnabhumi airport. And suddenly I saw a white car, a white van with the inscription, King of Bones, Vejthani. I said, okay, it's nice. But I embedded this lettering into my subconscious. And when it came to the operation or to undergo an operation, I reminded this event that I had at the airport. And then I opened the website, and having read all the good things about Vejthani, I said, this is my hospital. Let me go there. I immediately phoned up and they provided me with an appointment. Dr. Prem, he's my doctor. He was a very cheerful doctor. He has a good sense of humor, and he's really a tycoon in surgery, especially of the bones, you know. And I felt warm with him as soon as I saw him. And he explained me everything, you know, and he even showed me how it works, the artificial knee, and how he was holding a copy in his hand. And he said, this will happen, you can bend it, you can flex it. And I said, but I'm a little bit worried, you know, because I'm very sportive. I want to make sport after, to be able. And he said to me, don't worry, you know, within 2-3 months, you can resume to your favorite sport, as jogging, swimming, hiking, doing yoga. And it's true.
Mr. Simon Ronald Singer, he 71 years old. He very serious and very problem about his right knee. It's very severe pain, cannot move well, difficult to stand up, difficult to move. He feel like this more than 1 year and very suffer for this month. That's because he cannot move well and make he worry about the activities. He want to go back to the exercise. He want to running, he want to bicycling, he want to do all the activity by himself. But the pain and limit the motion of the right knee that make him cannot do like that. When he visit me, I check his right knee and the left knee. Both of them, it had a crepitation, it means had the osteoarthritis. But on the right knee, it had a flexion contracture about 5 degrees and have a wall cut deformity about 5 degrees. That's called the limit motion and limit activity of the right knee. After that, I sent him to do the X-ray. The X-ray is show on the right knee, it's very narrow of the space of the right knee compared to the left knee. And the bone had a deformity and has a sclerosing of the knee joint. That is mean it has very severe osteoarthritis of the right knee. This is correlated with the physical examination and his history of the pain. Like this, it means he had the osteoarthritis That's because he cannot use the right knee well. For this reason, I recommend him to do the surgery by the total knee replacement, by the minimally invasive surgery technique and computer-assisted surgery with the cruciate retaining and mobile bearing. Why to choose this technique and prosthesis this for him? Because he needs the natural knee come back. Because he want to go back to the exercise. He want to feeling the knee is come back. That's the cruciate retaining and mobile bearing prosthesis. This is can answer for natural knee for him. Furthermore, the minimally invasive surgery and the computer-assisted surgery can help him to cut the good and more precision and more accuracy of the prosthesis put back to his knee and very closely to the anatomical position and less pain that make him to early ambulation. After operation, the knee is come back very good alignment. It's a good ball-cut alignment about 5 degrees. This is natural knee. Only one night after operation, he can move the knee well. After that 1 week, the wound is good. I clean the wound and change the dressing. He can go back to do the exercise by walking, coming up and down the stair, and maybe a little bit jogging. Complete 2 weeks, stitch off was done. After that, he can coming up the stair well and no pain. Very important. He said no pain and can got more activities. After 1 month operation, he can go back to run, exercise, and do directly by himself. No need assistance. That's really perfect. He feel his knees come back, and he told me he will go back to Switzerland to maybe climbing up the mountain or the bicycling or do very heavy activity at that. I'm very happy that can make he can got his knee come back, and I hope he will happy too.
Yeah, I can say 97% I got back to the old stage before the severe pain came up, you know. I fly back to Switzerland. I will have a very nice mountain vacation there. In other words, I hike, I climb. I can do it. There is no pain. I mean, hiking, not too difficult, but just going up, climbing up, but without rope, you know, with friends together. And even I will take my mountain bike and pedaling up the mountains and downhill a little bit. But I'm very careful, you know. When we are together, they ask me, what about your knee? And I only tell them the most positive things because it's reality. I show them my knee and I said, look at the scar. You can't see any scar, you know. It was made so well. And I tell them whenever you have a problem, I tell it my Swiss friends. I said, don't go to Switzerland to undergo any operation. Come to Vejthani. I'm a self-payer. My insurance refused to pay anything because it was a pre-existing sickness. But it was worth. It was a good investment. Having paid it myself, it was a good investment.